Hi, welcome back to Dr. Shatabdi's YouTube channel. In this channel, I talk about career transitions, medical writing, medical marketing, and my experiences working in this field for the last over 6 years now. So, just to give you a little bit of context, I am a trained pediatric dental surgeon and I transitioned into medical writing. It's been 6 years now. Now, if you have been following my journey for a while, you know that there is not one deciding factor behind why I decided to kind of move ahead and transition into this field, but there have been many factors. One of them was that during the COVID period, dental clinics were shut down and we were not having, enough patients to see, and I had ample time in my hands and I wanted to do something with my passion for writing, and I kind of moved into this field. But that's just what you see on the surface. There has been many other factors which I might not have talked about openly till now. So if you are new to medical writing, or if you are a doctor, a dentist thinking about transitioning into some non-clinical careers, this video might help you. So when I talk about the different things that shaped my decision to move into medical communications, one of them was that after graduating from one of the top government dental colleges in India, uh, I decided to try my hands with private hospitals and dental colleges, and I submitted my resumes, my CVs, had a talk with the HODs, visited those colleges, and kind of tried to build my network and take up a lecturer, a professor, a senior lecturer professor in these colleges, because that's the entry level position that you get when you enter after doing your MDS degree. And I realized that the not stipend, that the salary they were offering was very low, and it was really very embarrassing to kind of have put so many efforts, so much efforts into being a specialized dental surgeon, and then moving into being a lecturer with that amount of salary. So that was one thing that I noticed. The second thing I noticed was that it was already overcrowded. Too many dentists, too many private dental colleges, open positions were limited. So the profession was already crowded. Even with specialization, the profession seemed crowded. So that was another thing that I noticed. The third thing that I noticed was that there was no government jobs. And you will be surprised to know that the number of dentists that graduate from different states in India and the government jobs that open up, the ratio is very, very, you know, disproportional. It's very, very illusional. And I know about states where for the last 6 to 7 years we have not had government, recruitments as dental surgeons. So that was another big eye-opening thing for me at that time. And there was also another thing, which is when you start off as a dental surgeon, you want to build your own clinic, you want to build your own dental setup, then actually you are looking at a huge investment. So the initial investment to build up your setting, to get a dental chair, the basics, instruments and everything, x-ray machines, the basic investment is huge. And for middle class families like me, though I had the support of my family, they wanted to support me to start my clinic, but I did not want to take that help from them, and I did not want that burden to be on them at that point of time. So yes, that was another thing. So overall, if I look back now, these were the four major factors that kind of moved me away from this profession, and kind of provoked me to explore something non-conventional, or something where I would enjoy, something that I would enjoy doing for the rest of my life, and I would build a life around it. So yes, if I look back at my journey, there has been a lot of struggles. It's not a kind of bed of roses, of course. There has been a very steep learning curve in medical writing, and the initial stipend and salary that you get, that is also very meager, coming from a government dental college where I was getting a decent amount of stipend monthly. So there were a lot of factors which went behind again building my career as a medical writer and editor. But again, if I look back today, was it easy? Not at all. But was it worth it? Absolutely yes. So yeah, so these are the things that I think nobody talks about. These challenges nobody tells you about, especially when you move away from your academic career and decide to follow a non-conventional or non-traditional path. um, so if you are moving away from your clinics or your dentistry, or from just being a surgeon or a doctor, and you are moving into any other fields, just remember this, that the path ahead can be challenging, and ask yourself one question: are you ready to take up this challenge or not? But if the answer is yes, you should go ahead and explore non conventional roles. If you love reading, writing, researching, medical writing can be a good thing for you, it can be a good starting point for you. So, yes, with that, I leave you today. I'll be seeing you again with another topic on medical writing. Till then, take care. And if you have any questions around medical writing or anything that you really liked about my videos, please feel free to comment in the comment section below. And thank you.